awaiting those results, when they came in and I found out that it was not only low, but very low, I just kind of let out a breath of air that I didn't realize I was holding. And it just made me feel more relief. I'm Carrie Rios. I'm 42 years old. I'm a resident here of Miami. I'm a mom of 2 small children. My cancer diagnosis happened a couple days after my daughter turned 1. And long story short, they went in and did a biopsy and there was a tumor and they took it out and they found out it was cancer in my uterus. So the treatment is chemotherapy. And I ended up having many rounds of chemotherapy, but I made it, I made it with support of friends and family and my physician. My physician was fantastic. And, here we are. I'm a cancer survivor. Unfortunately, I'm not a stranger to gastroenterology. I had my first colonoscopy and endoscopy at the age of 10. I've just had gastro issues for essentially my entire life. And I had an endoscopy done because I was having abdominal pain, bloating, and upon that endoscopy, he took biopsies of my esophagus and the pathology came back that I had a non-dysplastic Barrett's esophagus. I had heard of it, however, I didn't know a lot about it and I didn't know exactly what that meant. I knew it was a condition that was associated with acid reflux, but I didn't know that it was a precursor to esophageal cancer.
She presented with absolutely no symptoms that would have alerted me prior to the endoscopy and its findings that she had any sort of issues with reflux or Barrett's.
And he called me and let me know that I had Barrett's esophagus. I had a little bit of PTSD, if you will. So it's kind of like, oh boy, here we go again. Like, what can we do to ensure this doesn't happen?
Her cancer doesn't go along with the same cell lines as you would expect with Barrett's esophagus and its eventual progression to esophageal adenocarcinoma. But the mechanism that led her to develop that cancer may be involved in all her cells. So whenever any of my patients have a cancer diagnosis, I always take a little bit more of a vigilant approach.
And so his protocol was when he gets a diagnosis is to then do a follow-up endoscopy a year later. And that year later was coming up when I was getting started with Castle. I actually have Barrett's esophagus and I represent a test that can give the probability of progression, which in my case was information that I couldn't put a value on that, seeing that I've already survived cancer once. And I certainly didn't want to have to walk down that path again if I had the opportunity to prevent it. And that's what I saw at TissueCypher for myself and other patients.
I was new to the TissueCypher world. I was excited because I had just learned about it. So this was a perfect opportunity for me to use exactly what I had just learned in a real world situation, particularly with someone who was under my care. Submitting her tissue for testing easy was probably an understatement. It was seamless. There was nothing additional that needed to be done on the patient side or my side from a clinical standpoint. And it got submitted and within a few weeks we got the results. A weight was lifted. After her journey, anything that could potentially be leading her down another path with the same type of issue, albeit a different cell line. And knowing that that wasn't the case, it was just this proverbial weight was lifted off her shoulders. Given the fact that her TissueCypher risk classification was so low, and her score was so low, and her probability of progression was so low, we actually made the decision that if we wanted to push out her surveillance endoscopy to the 5-year mark, we would be more than comfortable doing it.
Knowledge is power, and when I'm speaking to people in the office, at least one person almost every day tells me my friend, my family member, etc., has Barrett's. They should do this. I tell them absolutely.
It's almost a knee-jerk reaction for me to use TissueCypher at this point with my patients. It's the best thing I can do for them.
For me, my future looks bright. I'm healthy, I'm young. I have young children. I look forward to, them giving me many more gray hairs, working hard and, just loving the life that I was, given a second chance to have. And now, especially with TissueCypher, knowing at least my opportunity to progress to esophageal cancer in the next 5 years is so low that that's certainly in my rear view mirror, and I can just focus on the future.